I'm Dr. Maynard, bariatric surgery at Sama Bariatrics in Atlanta, Georgia. Bringing a video today to you to talk about why we do bariatric surgery, to hopefully encourage our young medical students and residents to pursue a career in bariatric surgery, and to maybe give you a brief overview of how our surgeries have evolved over time. When you look at obesity and all of the downstream problems it causes to your overall health and the increase in cost to the healthcare system, it is one of the biggest areas that we can make an impact into a patient's life. It also helps with the patient's quality of life, not just their health. So a bariatric surgeon brings a couple things to the table. One, we provide a structure that the patient can use to be able to change the habits that they have, to put their habits in a place where they're winning with their habits instead of losing with their habits. Two, by bringing surgery to the table, we allow them to increase their probabilities of success over time. And three, by having a good support and accountability network for the patients, we give them a framework where over time they can not only lose the weight but maintain the weight successfully over time. So that's what I think as bariatric surgeons we bring to the table in healthcare. The third part of that is going to be a cost differential. If you have a patient who is overweight with multiple medical problems, they're taking time off from work to go and see their doctors several times a month. They're having flare-ups of their medical issues which require them to either go into the hospital or visit their primary care physician. They're taking multiple medications, maybe have a CPAP machine, and all of these add substantial cost to the system as a whole. Take that very patient, put them in a good program, have surgery. 2 years later, their weight's normal. Most of their medical conditions are gone. They're no longer taking medications for it. They're not taking their CPAP machine. They're not missing work to have doctor visits. And that patient, from a purely financial standpoint to the system, is a net contributor as opposed to a net detractor. Now, when it comes to medical students, as you look forward to a career in bariatric surgery, the path for you is really straightforward at this point. Not quite how it was, let's say 30 or 40 years ago. You would go to medical school, you would have to figure out during that, do you like surgery and do you like the opportunity to impact patients' lives from a surgical standpoint? If that's the direction you want to go, you would then do a residency in general surgery, focusing on laparoscopic and robotic surgery over time. Then, when you finish that, you do a fellowship in either minimally invasive surgery or in bariatric surgery. And coming out of that, you would be a bariatric surgeon with the training and understanding of how to manage overweight patients, morbidly obese patients, and help guide them through the process of getting to a point where they can be successful in not only losing the weight but maintaining the weight over time. Thank you for looking at this video. If you like our channel, please subscribe to our channel. Click the link below so we can have a conversation in the office about weight management and the opportunities for us to help you to succeed.